Good night, everyone. Welcome again to one of my webinars. I want to thank brightbud.com for sponsoring. For those of you who are new, my name is Jaime Mason. I'm a medical doctor. I work mainly in the emergency room and with chronic conditions. I want to remind you all that your microphones throughout the presentations are going to be muted. But at the end of the presentations, I'm going to give some time for questions, which is my favorite part. I will also like to invite you all guys to leave some video questions. If there are some that I might not be able to answer today, leave them, go into brightbud.com and just record it. And me or somebody else who is knowledgeable about this will answer your questions. This presentation and what's in it comes from my medical knowledge. It's my advice, but obviously does not replace a medical consultation. So let's begin. Today we're gonna be talking about menstrual disorders. And I think the biggest question here is what's considered normal. It's a very interesting subject, actually a little bit long, but hopefully we're going to be able to give a general explanation about them. Usually I begin my presentations giving some numbers. In this case, it's difficult and I'm not going to do it because there are several and so many different disorders that number might be very different. Yeah, very different. But I guess it's fair to say that menstrual disorders are very common, as much as 1 in every 10 women and sometimes even more have it. So I think it's very relevant to talk about it. But first, when we talk about the menstrual disorders, we have to understand what's the menstrual cycle. And of course, for women, that's easier to understand because obviously they're the ones that are having it every month. But of course, there are certain things that that it's good to just remember and learn if it's the first time you actually hear about it. So basically the menstrual cycle, it's what happens to the female body since the first menstrual period. Basically, it's a series of steps that happen in the body that are marked by the menstruation. So that's basically what we will consider the beginning of this cycle. And of course, it's the beginning at the end. That's the whole thing about calling it a cycle. So here I have 2 different images that basically tell us what's happening inside and in a hormonal level. So in the right, you will see pictures of the female reproductive system, and in your left, you'll see a series of lines and pictures and that I will explain, of course. So here you'll see the first step, which is the menstrual phase. So that's the first day of the woman's cycle when they are beginning their menstruation. Basically, you can see in the picture that there's this bright dark red part, which is the endometrium. For those who were in the previous webinar, you already know that the endometrium is the lining of the uterus, the most inner part of the uterus, and it changes due to hormonal changes in the body. So of course, when this part of the body starts shedding, it causes the bleeding. So in this part correlates with this part of the picture, which is the beginning of the cycle. So in this, the first box here from the bottom up, you'll see that it shows how thick the endometrium is. So here we see that it starts getting thinner as, of course, the menstruation happens. This is the beginning of the period. And you'll see here other things, for example, the levels of how the estradiol and the progesterone is, and this is very, very, very important. Probably the temperature, which is shown here, it's important for something else, but not really this. this topic. And here you might see the ovarian cycle, which means what's happening to the follicle, which is the part of the ovary that creates and produces eggs. But basically, what we see here is that the cycle starts with a base level of estradiol and progesterone, which is basically the same, they're equal. And then as the cycle develops, the estradiol begins to increase. They both increase, but estradiol increase more than progesterone. You'll see that then, as this happens, the endometrium, this inner part of the uterus, begins to grow and gets thicker until it gets to the day 14. You can actually see here that's the day 14. That's where the ovulation happens, which means that an egg is released. Of course, when an egg is released, that means the female body is ready to get pregnant, basically. So of course, the whole body, it's preparing for that to happen. So the endometrium, which is the tissue that will actually host this implantation, which we call, it has to be thick, has to be rich in blood vessels, how you see here in the picture. You see that after the ovulation, the estradiol goes back to equal the level of progesterone, and then they begin to rise again. But now, during this phase, which is basically after the ovulation, we already passed the follicular phase. Here in the ovulation, in number 3, you see that the endometrium is thick, and you see that these hormones, now the progesterone, is higher, the level is higher than the estradiol. And then they peak and they slowly begin to fall again until the cycle begins. So basically, that's what's happening. Estradiol rising at the beginning of the phase before the ovulation. Estradiol peaks more than progesterone, then it's the opposite. Progesterone is more than the estradiol, and then they both fall into a level, and that's when menstruation happens, when they both go back to the same level as they started here in the ovulation, and that's like the trigger for the menstruation. So that goes back to the cycle. I know it's kind of a lot of information, but this will be helpful to understand the rest. So what is considered a disorder when we're talking about menstrual periods? Well, there are several conditions that might be considered a disorder. I'm going to talk about the most common ones. Missing periods, I think that's the most common one. Frequent or infrequent periods, that means you have one period or 2 periods a month, or you have one every month and a half or every 2 months. Heavy or light bleeding, that's also one of the most common disorders. And the last one, which it's very common, but usually women do not go to their doctor for that, it's painful periods. So that's also, or that might also be a disorder. Let's begin with missing periods. So the medical term for missing periods is amenorrhea. It's basically the absence of a menstrual period. Usually, medically, we start studying this when you miss more than 3 in a row, but just missing one, it's considered amenorrhea. Or can also be considered not having the first period after the age of 15, because that's a very common question. When is it too late? I mean, when do I have to worry if I never got my first period? So 15 ages or older, I mean years or older, it's basically the number we use. Well, of course, the causes, number 1, very obvious, pregnancy. So That's the reason why you go to the doctor and you say, okay, I'm skipping periods and I haven't had my period in 2 months. Of course, the first thing we are going to do is a pregnancy test, because of course, maybe that's normal for you, but eventually that might be a pregnancy and we have to make sure. So that's number one. Number two, it's breastfeeding. Breastfeeding is also very common. So it's normal for women who are breastfeeding to miss periods. Actually, not having periods might actually happen also. And it's considered normal, especially if the breastfeeding is constant, which means probably 4 or 5 times a day, and it's the exclusive way of feeding your child. So if you're giving only breastfeed, probably that's when this might happen. Of course, I'm going to talk about this in another webinar because this is also a very interesting topic. Another cause for that is the menopause, and it might be also obvious, but of course for women, this is something that will happen, but they're not sure when. So of course, if you're used to getting your period every month and suddenly you start skipping periods, then you're not really sure if you have a problem or you're getting into menopause, because you don't know if it's going to happen at 35, 40, 45. Usually you hear that's after 45 or 50, but it can happen before that. So that's one of the causes. In those periods of life, like the first and the last menstruation, the periods start to be irregular. Medications and pills, of course, are very, very common cause for this, especially contraceptives. Oral contraceptives are the most common pills to cause this, and also injections, or any hormonal medicine might cause it, including thyroid medicine. Being abnormally thin, and it's very related with exercise. Why? Like I always say in my other webinars, the body is very wise, so it will not lose blood if you're already very weak. So people having, for example, anorexia or any other condition which might lead you to dangerously low body weight, well, the body doesn't have it's not gonna lose that amount of blood because it might be dangerous for you, so they stop having periods. And of course, this happens also with exercise. If a woman in this case is exercising too much, certain hormonal changes might occur, and then as a result, the whole period disappears. But of course, you have to think in the cycle, like I was telling you, to actually understand what's going on. So basically, what you're gonna see that's very common in today's webinar are hormonal changes and hormonal reasons for this, because that's the core of the menstrual cycle. Of course, there are some other cases, polycystic ovarian syndrome, which I already talked about. As I said, it's the origins of this condition is a hormonal imbalance in which male hormones are produced in higher amounts or more than normal. So of course that will change everything and will cause you to stop. Actually, in polycystic ovarian syndrome, what's happening is that the whole cycle changes so much that there's not even an ovulation. So that's what we call anovulation, which means there's never an egg that's released. So of course, if the egg's not released and the whole cycle is changed, then there's never going to be a menstrual period. Thyroid, it's also a very common cause for this. If you have hypothyroidism or hyperthyroidism, they both can cause amenorrhea. And the last one, which is weird and not really related to the others, is when one of the causes of never having your first period is basically having what we call imperforate hymen, which is that the membrane that covers the vagina, it's never, I mean, the women are born with that membrane covering the whole vagina, so the blood is never able to actually exit, so it just remains inside, causing, of course, bunch of problems because it gets accumulated there and it goes to the ovaries and it has to be surgically treated. This is not very common, but it's one cause. Frequent or infrequent periods, which medically we call it poly or oligomenorrhea. We have to understand that basically menstrual cycles are between 21 and 35 days long. That's what we consider normal. So I guess that's one of the answers of the first question. So 25 to 35, that's basically normal. And it can be a range of different days. For example, it might be normal for one woman to have it every 22 days or every 3 weeks, and it's normal for somebody else to have it every 35. Now, when it's less than that or more than that, longer than that, then we might have an abnormality. Causes here, it's basically hormonal. As I try to show in the first, or actually the second slide, the menstrual cycle is divided in certain stages or periods. Basically, when we have one hormone that it's overproduced or not produced enough, one of those will actually get longer or shorter, causing that the whole cycle become longer or shorter. Again, thyroid hormone, very, very common. So that's one of the things we're actually going to check when you come with this complaint. Estrogen and progesterone levels, we also try to test them. Prolactin, which is a hormone that's produced, the last four, prolactin, FSH, and LH at least, are produced in the central nervous system to regulate the whole, the rest of the cycle. If there's an imbalance in this, of course, it might happen. Why? Maybe there's certain medication that may be affecting the production of prolactin. Maybe you're having chemotherapy and you have estrogen blocking medications, or you're taking hormonal replacement, or basically because of the other reasons that we talked about that might change the hormonal balance of the body mass index. So fat, as I mentioned in other webinars, might produce this. And cortisol, the last one, cortisol is the stress hormone. So when the body is under stress, no matter if it's pain, exercise, or even mental stress, it produces cortisol. And cortisol can disrupt the menstrual period. So there are cases in which even mental stress might cause this. And this is very common in our modern society. Heavy or light menstrual bleeding. This is, I guess, having light menstrual bleeding, it's usually not much of a problem. Having a heavy bleeding is very, very common, probably one of the most common, if not the most common problem in women that are age 40 and older. Of course, when I say that light menstrual bleeding is not usually the reason for a consult, that doesn't mean it's not a problem. It's simply that it doesn't bother them, so they never go to the medical consultation, but it might be the sign of a problem. So they both have to be checked by a doctor. We call this hyper or hypomenorrhea. Basically, it's actually very difficult to define how much is light bleeding, but let's say then less than 2 days. And of course, longer than 7 days, that's considered a heavy period. Or having to change tampon or a pad every 2 hours or every hour, that's also heavy. That we consider hypermenorrhea. The number one cause for that are fibroids or anything that might change the shape of the uterus. And I guess I'm gonna talk about this because this is actually the most frequent reason why females go for a medical consultation. Hypermenorrhea, heavy bleeding, and in most cases, it's because of fibroids. Some cases, polyps, but mostly fibroids. So I'm gonna stop here a little bit in this picture just to explain. So basically, we have here the image of the uterus, which I've shown to explain different things. Here you see the lining, which I already talked about, which is the endometrium. Here they don't pay much attention to that because they want to focus the attention on this layer, like the dark pink layer, which is muscle. So of course the uterus, it's basically a muscle that has the ability to enlarge and grow to let the fetus, a baby, grow inside, but then it has to have the ability to contract so that baby can get out. So it has a lot of muscle. Sometimes, and actually most of the times, with age, some masses which are in the middle of this muscle start to grow, and they can grow to the outside, it can grow in between the walls of the uterus, or it can grow towards the inside of the uterus. And of course, these are the ones, like the one I'm showing here, that causes most of the problems. Why? Because the lining of the uterus, the endometrium, has to be smooth. So when the menstrual part of the cycle comes, it might actually be like it can shed evenly. But if there is something that changed that shape of the uterus, like a fibroid in here, well, of course, there's blood that's going to get accumulated here, and it's going to be difficult to evacuate. So that period is going to last longer. Of course, the parts under the fibroid are gonna remain normal, but probably here they're going to take a little bit more time to actually evacuate that blood, that tissue, because it's not only blood. How normal is this? And I want you to understand that it's very common. I wouldn't say normal. I would say it's very, very, very common to have fibroids in the uterus, especially after age 35. And as women age, they will start having more and more. They cause several problems, including pain, infertility. But of course, this heavy bleeding, heavy menstrual period, that's number one symptom. Of course, if a fibroid is small, it won't cause that much problems, but I want you to understand that I'm talking about large fibroids, which are probably the size of a tennis ball or even larger. So, okay. Here are some other causes: hormonal imbalance and endometrial cancer. coagulation problems like hemophilia might cause heavy bleeding. And painful periods, basically, it depends. Each woman is different. Basically, it's a problem when they last longer and when they're not related to symptoms as diarrhea or vomiting, which is very common actually. So that's when you should actually go to your doctor. I just want to tell you that here there's a topic which is the endometriosis, which might cause painful periods, which I'm going to be talking in the next webinar, and probably I'm going to do a part 2 of this one. So let's go to the questions. As diagnosis, regular exam, ultrasounds, which I already talked about, hysteroscopy, which is basically going with the camera and watching the uterus, and hormonal levels. Basically, that's what we do. Please ask me, because the questions are the thing that I enjoy the most.
Dr. Mesa, in cases where this can probably be some sort of abnormalcy, whereby you would hear that women are saying that they're pregnant but still have a period. And I know sometimes we get that period confused with actual vaginal bleeding. Is that some sort of abnormalcy too that would hamper males?
I couldn't hear the last part. I'm gonna give you the answer to the question, and then you tell me if I answered the whole question, because it got a little bit broken at the end. But it is. I mean, I hear all the time of women telling me that when they were pregnant, they still had their periods, or at least the next period. So they were never sure they were pregnant. There's actually 2 different explanations for this. It is normal to have bleeding basically at day 6. Of course, this changes with every patient, but at the day 6 after the implantation of the embryo, there's a little bleeding. So women might confuse it with their menstrual period. And of course, if this happens around the day 15, 6 days later, which is the day 21, that might be very in the time where you were expecting your period, because usually it takes about 26, 28 days for a normal period. So if this happens at the day 22nd, then you might confuse it and you say, oh, I came earlier, but I had my period. The second explanation is that every time there's movement with the embryo, which there shouldn't be, but if there is some movement, the endometrium will start bleeding, and this might cause very light bleeding. But of course, this would be an emergency. If you already know that you're pregnant and you're having any kind of bleeding, you should go to your doctor, because what we do is that we have to perform an ultrasound to see if there is any cause for that bleeding. Usually we will find a hematoma, which is blood accumulation in the back of where the embryo is implanted. So we know that there's a chance of having a miscarriage. So we have to do certain things to prevent that. But certain women never go to the doctor, and they think that bleeding was because of their menstrual period, but it was simply because they were having actually the first signs of miscarriage. And maybe that never happens, and their babies simply are born normally, and some others might actually have the miscarriage. So I don't know if that answers your question.
Partially, but I can live with that.
I'm sorry if maybe I didn't hear the last part.
That's okay.
Dr. Mesa, I have a couple questions. You said that in certain abnormalities, a woman is unable to produce the egg entirely. Is that correct?
Ontario?
Yes.
Okay. So in that case, um, does it mean? I'm sorry. In that case, does it mean that that they never enter menopause?
Well, we have to understand that women are born with the number of eggs that they're going to produce through a lifetime, different from men that we produce our sperm daily, every second, every minute. They, since the moment they're born, we already know, I mean, how many eggs they're going to actually produce. So, of course, if there's cycles in which an egg is not released, of course, that means that's an egg that's going to be saved for later. So they might have menopause, but for those women, it might actually start later on. Of course, they would have to miss a lot of periods in their life to actually prolong that for years. So it's usually not very common, but in theory, it might happen. But of course, what's important about never ovulating is that women are skipping periods and they just think that they are having a long period, but they are never able to have children. That's the part that's actually important. That when a woman comes for something, we actually discover that they're having these cycles with no ovulation. So in the future, they're not going to be able to have children if they don't solve this, which is very easily solved.
Okay, that is helpful. And can you explain to me what the difference between polyps and fibroids are, or what the difference is?
Yes, there are several differences, but this basically two are the most important. The shape is one. Usually polyps have are longer and they're attached to the surface of the endometrium with what we call like a foot. And fibroids are just masses, like round balls that are coming out of the muscle. So they never have like this foot that you can cut. But that's not the main difference. The main difference is that basically fibroids are made of muscles, or at least in the muscle tissue, but polyps are made from more outer layer, so they're actually easier to remove. Polyps are very common, and by a simple procedure we can cut them, or even like they can fall by themselves, while fibroids are so in the muscle that they're never gonna, I mean, not usually they're gonna fall. So basically one are muscles and the other ones are more of connective tissue. That's the main difference.
And is one inherently more dangerous than the other? For instance, if you leave polyps alone, could that develop into something more dangerous than if you left fibroids alone?
Well, fibroids usually are not, I mean, if you're talking about cancer, for example, which I think you are, fibroids are not very related to cancer, not as a risk factor. Polyps might become cancerous lesions, but not very commonly. They're both weakly related to that. I would say that polyps might be more dangerous for that, but the difference is very, very small, and they're actually not very related to that. Of course, they're related to other problems, especially this menstrual abnormalities and infertility and pain. So actually, this is number one cause for hysterectomies for the removal of the uterus, because they start causing serious problems. And I'm talking about fibroids more than polyps.
Thank you very much.
Okay.
Dr. Mesa,
Yes.
what is a prolapsed fibroid and what causes it?
Well, a prolapse, we call prolapse every structure that is trying to exit abnormally through a place that it shouldn't. For example, basically the uterus has an opening. Well, it actually has three openings, let's say one for each tube and one which is in the cervix. But let's say that the only actual opening that is supposed to be an opening is the cervix. So everything comes in and out through that little hole in the cervix. If any structure tries to get out through that hole, it might be a prolapse. For example, the uterus itself, if it tries to get out through that hole or through the vaginal opening, we call it a prolapse. So a fibroid that's trying to exit, it's a prolapse. That's basically what's happening. So it's just a term for us to know that this fibroid is too big, that is just trying to exit to a place that it's not supposed to.
Okay, so it would be attached to the endometrial area, and it's trying to come out through the uterus?
Yes. Well, fibroids are attached actually to a more inner layer, which is called the myometrium, the muscle, not the endometrium. That's more of polyps. But it becomes so big that actually covers the whole uterus. So it starts to exit through whatever hole that's there, and of course the vaginal hole and the cervical opening are the obvious exits for that. So they're trying to prolapse. So that means they're trying to get out of there. So for example, when we're doing an exam, what we use is we put the speculum in, and we're supposed to watch the cervix, which is like a donut-shaped object. But instead of that, we might actually see another structure that's actually moving the wall of the vagina, and we call that a prolapse. So actually, is the whole fibroid trying to push the whole uterus out. I know it's kind of hard to explain, but that's basically what happens.
Okay, thank you.
You're welcome.
Have you come
Dr.
across
Mays,
any?
you mentioned a condition whereby the vagina never really opened.
Yes.
What's the name of that condition?
That might happen in two different conditions. One, it's called basically imperforate hymen, which the whole vagina or the vaginal canal, it is developed, but just the opening, it's covered. So nothing can get out of that. It's very simple just to cut that layer and let everything out. There's another condition that's called vaginal atresia, which in this condition, which is more severe, the vaginal canal never develops when you're a baby, because these organs are developed because of hormonal influences. And if there's anything that changes, that influences, then the body is confused if they should produce a female body or a male body. And in some cases, they simply start developing the part, but then they never have time to complete it. So basically, there's no opening. The vagina never develops. That can also be fixed with a more complex surgery, but of course, it's more complicated than just having the hymen, which is normal for every woman to have it. It's more complicated to actually never develop the vagina. It's not very common, but it happens.
So would that then lead to what we would call a hermaphrodite condition, or no?
Well, it might be part of what we call pseudo-hermaphrodite.
Oh, okay.
Well, the word pseudo means false, so it will be a false hermaphrodite because it's a woman, but just the outer part of the genitals are not developed properly, but in the rest of the body it's a female, so it's a false hermaphrodite because there are actual conditions in which a person has both male and female cells and genetic material, and those are the real hermaphrodites. In this case, everything's female, just that a little hormonal signal was not detected and just the outer part of the organs are not developed. But this patient has ovaries, has a uterus, has everything else, so it's a pseudo hermaphrodite.
Oh, okay, thank you.
Have
You're
you come
welcome.
across anything that can't really be treated, but it's just like natural, and right now they don't know how to treat it?
About regarding what?
Well, regarding periods, anything like that. If there's anything.
That cannot be treated?
Yeah, yet at least.
I mean, there are difficult cases, women that have big hormonal imbalances because they had accidents and the brain is damaged. So of course, if the central nervous system is damaged, the whole hormonal thing is going to be total mess, and they're difficult to treat. But I don't think it's actually impossible. Actually, in my experience, it's quite simple most of the cases. Basically, with oral contraceptives which have certain hormones, most of these conditions can be fixed. But I guess there are cases which are impossible to treat, but I would say they're very, very few.
Doctor,
Yes.
I've heard the terms PMS and PMDD used interchangeably, but I've also been told that they're not the same thing. And my question is, do they correlate to the menstrual disorders?
Definitely, they are part of this. I said I was gonna mention a few, but there are others that I didn't mention. And yes, you're right. PMS, which stands for premenstrual syndrome, it is part of these conditions, and the dysphoric premenstrual dysphoric dysfunction or symptoms. I don't remember the exact term, which is that you're talking about. They were considered the same condition in which a female experiences certain changes which are very symptomatic, and actually changes, or how should I say that, impairs them to live normally when they're having their periods or before. So premenstrual syndrome basically refers to mild symptoms, which in the other hand, the dysphoric symptoms, which are the others that you're talking about, are more severe, not only mood changes, but a certain hormonal imbalance that might produce other types of symptoms, which might be sweating or hot flashes, even psychiatric type of symptoms, which might be anxiety, depression. So that's when we divided those two conditions in just normal, let's say normal premenstrual syndrome, and premenstrual dysphoric dysfunction or syndrome, which is more severe.
Thank you.
You're welcome.
Dr. Mesa, why is it that when your period starts earlier, you end later?
You mean in life or
yes, in life? In life.
Well, that's a difficult question. I wouldn't say that's the rule necessarily, because like I was telling you, what determines how long, for how long are you going to have periods is the number of eggs that you have in your ovaries. So let's say you were born with, I don't know, 100. That means you're only going to have 100 cycles. Of course, the number is bigger than that. So I don't know what determines that if some women have more eggs than others, but I'm not really sure if actually it relates that way. It's a difficult question. I wouldn't say I wouldn't know the answer if that's really true. I wouldn't think so. I don't know.
It's something that I've always heard, that if you start your period as a young lady, it always ends older than you typically would. You know, someone who started later would normally end earlier. So I was just curious.
I mean, and you mean ended earlier?
If they start their period earlier, they end later in life. If they start their period later, they end earlier in life.
Well, I would actually, in my opinion, I would actually say it's the opposite. If you started earlier, you're gonna end it up earlier also, because you're gonna run out of those eggs faster. Of course, it might happen that the signal for you to have your first period is hormonal. And if you have, or throughout your life, you're experiencing that much hormonal input, then you might have certain cycles in which you're not actually ovulating. So that might prolong your cycles. Maybe you're having one that you ovulate, two that you don't, then you have one that you ovulate again. So that makes you extend those periods. But I would say actually the normal thing would be the opposite. If you start earlier, you will have menopause earlier.
Okay, thank you.
You're welcome.
Just another question, if you don't mind.
Yes.
If heavy bleeding is so common among women, at some point, shouldn't you say it's not an abnormality?
That's an excellent question, because actually the name I decided to call today's webinar "What is Normal," and that's something that is getting confused. And I think the main reason is that it's not in our culture to talk about these things, because in so many places in the world, the menstrual cycle is something to hide or to be ashamed. So you don't talk about this. So you just think that's normal. But I do think that it's important to understand that a normal cycle, in theory, it's 21 to 35 days long, with a bleeding that's not longer than 7 days, and usually not shorter than 3. That's basically normal. If you have anything that's not that, you have to be checked just to see if you're just have a variation of that, which is still considered into normal, or you don't. But it's very common, but definitely not normal, because it is related always to some condition. If it wouldn't be related to that, then we will change the term and actually call it normal. But since there's always an overlaying reason for this, then we have to say it's abnormal.
Thank you.
Okay. Well, thank you everyone for your attention. Remember, if you have further questions, go into brightbot.com and record them. I will try to answer all the questions. And have a great night.